So continuing from here, which of the following is the most specific sign? This is a different thing that I'm asking now. Most specific sign of pneumothorax on ultrasound chest. We have seen different features. We have seen absence of lung sliding on B mode is also a feature of pneumothorax. Absence of cometal artifacts on B mode is also a feature of pneumothorax. Stratosphere sign is on M mode is a feature of pneumothorax. But what do you mean by lung point? What is lung point? It should be present or absent in pneumothorax. Let us see the concept behind this now. If there is a partial pneumothorax, that means some part of the, if I just take a cross section of the CT scan, can you see this part of the pleural cavity is normal, there is a lung, pleura, and this part of the pleural cavity is having air in it. Can you see this part of the pleural cavity is having air? This is jet black air, this is lung. So if there is a partial pneumothorax, that means some part of the pleural cavity is normal, only some part, if partially the pneumothorax is present, so the air will rise up, so only some part of the pleural cavity is having air, other part of pleural cavity is normal. In such a case, most specific sign on ultrasound is the lung point, presence of lung point. What is the lung point? This transition point. The pleura is normal and then suddenly the pleura is abnormal and it is having air. So this transition point is the lung point. So presence of lung point means there is pneumothorax, suddenly there is normal and then suddenly there is a abnormal feature. So this is how some part of the pleura is having air, some part is normal. So the part which is having air, there will be no lung sliding, there will be no B lines. The part which is normal will show you B lines, will show you lung sliding. So this is a transition. You put M mode, the part which is having air will give you stratosphere sign. Suddenly after this lung point, you go here, there will be seashore sign. So this is the lung point. Just place your probe like this and try to slide here and there and see where is the lung point. So transition point from presence of lung sliding to absent lung sliding, to from stratosphere sign to seashore sign. Are you seeing the difference? So this is a transition, so this is a transition. So transition point is basically the lung point. Okay, so going back to the question, most specific sign of pneumothorax is presence of lung point. If the lung point is present, you're definitely sure that there is a pneumothorax in this part of the pleural cavity. Okay. Which of the following is true regarding A lines? A lines on ultrasound chest. Okay, A lines, we know what are A lines? Horizontal echogenic lines. Horizontal echogenic lines beneath the pleural line, this is a pleural line. Beneath them you have the horizontal echogenic lines, A lines. This is true. Vertical echogenic lines coming from the pleural surface to the surface of the screen, what are these? These are your B lines, na? So this is a false statement. Seen in pneumothorax, A lines are typically seen in the normal lung. Okay, so A lines are seen in normal lung. So this is a false statement. And seen in subcutaneous emphysema. Remember that in subcutaneous emphysema, something you see are called as E lines. E for emphysema and E for E lines. Subcutaneous plain only has air. Okay, so there you will have E lines. So remember this, E lines are seen in subcutaneous emphysema and A lines are horizontal echogenic lines. So just for revision purpose, from the pleural line, vertical echogenic lines are B lines and horizontal echogenic lines are A lines. Okay. Just an additional very high yield field of topic. FAST is full form is clear, focus assessment with sonography for trauma. Similarly, in emergency setting, there are certain other protocols which are being advised. Just remember the names of them, and they are particularly used to assess dyspnea. In case of lung involvement, we have seen one is pneumothorax involvement, detection by EFAST, FAST, EFAST. Some other protocols are BLUE. Remember what is BLUE? What BLUE stands for? Bedside lung ultrasound in emergency. So here they will evaluate pneumothorax, pulmonary edema, pleural effusion, pulmonary consolidation, all. Radius is rapid assessment of dyspnea with ultrasound. Rapid assessment of dyspnea with ultrasound. So there they will evaluate the cardia and they will also evaluate the IVC. Rush protocol, rapid ultrasound in shock and hypotension. These protocols, these names can be asked. So you should have an idea what is blue, what is radius, what is rush. So bedside lung ultrasound in emergency, that is blue, it's used for detecting dyspnea and it's actually used for detecting immediate acute respiratory failure because it's detecting effusion also, edema also, consolidation and pneumothorax, all of these. Another important thing is, one is falls. So what do you mean by falls? Falls, just remember the full form, fluid administration limited by lung sonography. That means if a patient is in circulatory failure, patient is in circulatory shock, you are giving him fluids and fluids. Always look at ultrasound, see the IVC status, whether it is collapsed or whether it is normal. If you're doing overload, already the patient is in circulatory failure and you're giving him lot of fluids, the patient can go into cardiac failure, the patient can actually land up into fluid overload. So the fluid administration can be limited by sonography. Your sonography can guide you whether the fluid has to be given more or do not need to give it. So fluid administration limited by lung sonography is a protocol for management of acute circulatory failure. Falls, blue, radius, rush. Remember all of these protocols in addition to fast and e-fast, right? So thank you everyone.